Good morning, everyone. A warm welcome to every new Neurodegenerative. Today, it's my honor and privilege to introduce to you our distinguished scientist, Dr. Jessica Sharma, who has made significant contributions to the field of neurology, immunology, and molecular biology. She completed her PhD in collaboration with the Indian Statistical Institute and Indian Institute of Clinical Biology. She ventured into postdoctoral work at the University of Pennsylvania, USA, and later joined the neurology department at Thomas Jefferson University as assistant professor. She is currently a professor at the Biological Sciences Department of Indian Institute of Science, Education and Research, Kolkata, and also an adjunct associate professor at the Department of Ophthalmology, University of Pennsylvania, USA. She is also an elected fellow of esteemed institutions such as the Indian Academy of Sciences, Bangalore, the National Academy of Sciences, the Indian Academy of Sciences, and the West Bengal Academy of Science and Technology. The core focus of our research group is to identify new antivirals against the beta coronaviruses using murine coronavirus and mouse hepatitis virus induced models of neuroinflammatory demyelination. This model mimics certain neuropathological and clinical features of human neurological demyelinating diseases like multiple sclerosis and is a well-established model for viral-induced multiple sclerosis. Her groundbreaking research on murine coronaviruses and immune responses to viral-induced myelination has significantly advanced our understanding of beta coronavirus-induced pathologies as well as viral-induced mechanism of demyelination in with multiple sclerosis. Dr. Sharma's remarkable achievements have gathered her prestigious awards such as the ASM IUU SSTL Indo-US Professorship Award, the Lindblad Distinguished Teaching Award, and ASNCEU Leadership Award for International Educators, among others. She has over 76 publications and delivered numerous talks worldwide, showcasing her commitment to the scientific community and nurturing the next generation of scientific minds. Today, we are fortunate to have her among us who continues to inspire and drive innovation in the field of biomedical research. Please join me in extending a warm welcoming to Dr. Jayashree Das Sharma as we look forward to gaining insights from her background, work, and contributions. Ma'am, please take over.
Thank you very much for the kind introduction and good morning to one and all. And it is a great pleasure to be here in this Arthur Plus College Endeavor to set up the webinars as well as with physical meeting. So I will be talking to you. So can you see my slide? Okay, let see my slides also? Thank you. So, first of all, again, I want to take the opportunity to thank the organizers of the Sarkar College for giving me an opportunity to present my report. And I will be talking about the total infection and neuroinflammation and the underlying mechanism of neurodegeneration. If I understand correctly, the entire competencies, there are a lot of talks on neurodegeneration because it is focused to understand how the neurodegeneration or neurotransfer and also causes the problem. So that's what I decided to talk about neuroinflammation and neuroinflammation and how neuroinflammation leads to neurodegeneration. So here I will be with the neuroinflammation for people coronaviruses, which is a recent challenge to the nervous system causing neuroinflammation and neurodegeneration more hard than the of such focus as osteoarthritis virus, which also causes neurological disease, and we are using this as a model to understand the SARS-CoV-2 induced infection and inflammation and how it can lead to neurodegeneration. First, they look like when SARS-CoV-2 came in 2019 in entire world this disease and it was observed that in some of the patients being that though the is really affecting the lung and causing the alveolar years. We also have tendencies pathological manifestation and in COVID-19 patients. And among these diseases, there is a inflammation in the main disease, like the meningitis, and then there is a inflammation in the brain parenchyma, that is encephalitis, and inflammation in the spinal cord, which is termed as myelitis, as well as there are endothelial disease, which is called endothelitis, venous sinus thrombosis, ischemic and hemorrhagic stroke. Why these are happening in the central nervous system? Peripheral nervous system cannot be escaped also. Comorbidity is associated with dysfunction, as we all know that there is a dysfunction of spleen, yes, and there are muscle injury, and it also causes mild dystrophy. The peripheral nervous system is known as Guillain-Barré. So why it was observed? Nobody knows how the virus, when it is attacking the lung vein, can move the vein and can cause the disease. So to understand that, we have a murine coronavirus, which actually why we are focusing our studies in murine coronavirus and trying to understand the pathology of the human coronavirus SARS-CoV and SARS-CoV. So to give an overview of the coronaviruses, they are the largest known adenovirus and divided into four children using identity tree, that is alpha, beta, gamma, and delta. And most of the human coronaviruses, they belong to the beta coronaviruses, but some of the causes mild disease like human coronavirus HA1 and human coronavirus OC43. But as we all know that SARS-CoV-1 came in 2003, it causes severe illness, but the mortality was not that high. But when advanced COVID attacks the horses, and that is also can attack the human, but the emergencies are not that drastic. But SARS-CoV-2, when it emerges, it affects a large human health, and that is a threat to the human society. So, to understand the SARS-CoV-2, we have a human coronavirus, which is called hepatitis virus, which belongs to the family coronavirus and the genus coronavirus. And it is a single-stranded non-fluid polyhydroxy adenoma called polarity, and it is a prototype coronavirus because this experimental model of starting respiratory and fatigue as well as neurological manifestations due to their differential organ tropism, like the different tropism shown by different strains of human coronavirus, especially the SARS-CoV-2. So, what happens? Actually, the first thing I want to tell you how it actually mimics certain pathology of human coronavirus SARS-CoV-2. So you can see when you think the variant, the duration of the virus into the brain is a positive duration. Because I know I put the in SARS-CoV-2, you don't know when the virus infected human and what might be symptoms. But here we have a positive relationship, and that is the beauty of any model that we know that we injected the virus. And virus comes to the series and activates series cells, activates the microbiome, and there is a huge infiltration of cytokines and chemokines in response to the viral infection, and they actually brings the leukocyte and leukocyte infiltrates into the central nervous system, and then there is an inflammatory response, and this response is can be given out as meningitis, inflammation in the meninges, encephalitis, perivascular traffic surrounding the blood vessels, ventricular immune cell spike, which is stable with leukocyte bound antigen, CD45, and a large number of migrated cells and monocyte like we are macrophages, they are CD11 positive. And when it happens, this time viral RNA reaches its space. Infectious viral particle also reaches its space. But after that, after day 7, during day 7, the virus almost clears, and by day 10, you don't see much infectious viral particle. Whereas viral RNA, they also reduce as infectious virus is cleared, but they came to some extent into the system, and people believe that that actually is responsible for the long COVID. Like coronavirus disease happens, like silently virus is cleared, but viral RNA, presence of viral RNA can also initiate the disease. And that is the main theme for today's discussion, because in SARS-CoV-2, lots of people survive from SARS-CoV-2 infection rapidly, but they develop long COVID because viral RNA is present. Our focus is to understand how viral processes can lead to chronic progressive demyelination in mouse and virus, and these demyelination mimics are aspects of human neurological disease multiple sclerosis, and there are concurrent axonal loss which actually causes long progressive disorder. So people go to wheelchair, that is comparable in mouse system, mouse develop severe liquid paralysis, and for that we cannot walk up. But what happens, when infectious viral particle clears by the immune system, there is a serious tries to establish the homeostasis, and in that homeostasis, peripheral immune cells interact with the CNS immune cells to bring back the homeostasis. So that's what we are going to try to focus on, explain how this model will help me to understand the biology and the disease side, starting from the viral inoculation to the down the line or some chronic progressive diseases. So here, first you know what we wanted to see what are the genomic control of the pathogenic properties, because this virus, as I showed you here, is single stranded polyadenylate RNA, individual RNA segment infect this by targeted recombination. So what we need to understand that what genome is responsible for the myelination phenotype. We make two isogenic recombinant strains. One is the spike protein from the myelinating strain, and another spike protein is from non-demyelinating strain. And both the viruses we engineered that it expresses enhanced fluorescence protein. And when we interpret it, we have observed that both the virus can cause encephalitis, meningitis in a similar manner, and there are accumulation of lots of CNS immune activation, and they are mainly microbial macrophages, which is called super CD. But the difference lies, as I told you, like when virus is cleared, but the virus RNA presence of viral RNA can cause demyelination, and I will explain why demyelination happens concurrent with axonal loss, but in non-demyelinating state they do not cause any demyelination or any axonal loss. And this is the summary of a series of studies which published in very good peer-reviewed journals, Journal of Biology, Journal of Microbiology, And we showed that the spike protein of viral coronavirus is one of the major elements of virus-induced myelination and abstinence. And it makes sense because spike protein is attaching to the host protein and boosts receptor specifically and allowing the virus to enter the receptor-mediated endocytosis or just endocytosis. And these are responsible for fusion cell to virus fusion. So that's what we wanted to see, like how whenever we place these two states and how we can explain the mechanism. So when we compare the demyelinating state and non-demyelinating state, viral and state, viral and specific cell infection, and our summarized data see that demyelinating state can migrate from gray matter to white matter, and the white matter it causes severe like infection, whereas in non-demyelinating state, the virus retains the gray matter, they could not go to the white matter. Confirm that we also the help of producing histochemistry where we use the viral antigen and with the analytics you can see very elegantly that at any point the viral antigen is present both in the matter and little bit in the white matter. But in non-demyelinated state, they are restricted to the matter or a white matter. But at least the majority of the viral critical replicates progressively the white matter. So that means they make the white matter cell to the astrocyte, oligonucleotides, and maybe microglia in the egg matter, mainly oligonucleotides. Whereas in non-viral state is pre-viral, it is produced, but we are mainly the later where they make the results because when you relate with oligonucleotides, this is one of the cells which forms money also the dividing state significantly get the large number of nucleotides to ignore get clearly that RE2 is a nucleus specific transcription factor and it's surrounded by the viral cytoplasmic expression. So they state that adding the polymerase then we attribute the dimension that was accumulated in the data having to contribute to myelination. But not surprisingly, non-demyelinating state they are being decided in the gray white matter junction and they did not move the white matter to the instead they affect the gray matter oligonucleotides. So we can see a transcription of DNA state viral antigen of gray matter to white matter during acute stage mutation in addition to the oligonucleotide oligonucleotide infection in the spinal cord, maybe it is possible for viral induced myelination. So then we try to show that what is happening in myelination, and we observe as I showed you that there is a large myelinating plaques in the myelinating state but not in non-demyelinating state. So we wanted to see what type of here we see in research there are a large number of the macrophages are present because they do not have this mechanism. And I'm sorry I didn't show you the slide, but I used to show a large number of singular. When we took that one page of 600 lengths of the sections for transmission clinical microscope, we showed that by the infection causes severe axoplasm loss as well as myelin loss and causes accumulation in the nervous system in the white matter. After instance is that the myelin sheet is hypomyelinated or completely demyelinated. So what we observe here that macrophages are sitting in the close association with very high resolution. We observe the textbook findings that monocyte bacterial macrophages which are activated and phagocytic in nature, they are phagocytizing the myelin from the dead sick neuron because myelin sheet is departing from dead sick neuron as virus related to the axoplasm and myelin sheet axoplasm loss of axoplasm is of this macrophage myelin stripping is is not observed in non-humanitarian state, there is the only compact, like abnormal compaction of the microbial, but not like scientific nature of microbial macrophages which is keeping the mind. So when we do that, like in summary, we can say that maybe this place of the matter to white matter only the key checkpoint for the initiation of the mind, nature and excellence. Microbial macrophages mediated mind distributed is one of the key mechanisms of DNA to improve the mind and excellence. And the malignity is an infection begins in the neuronal cell body and propagates scientifically to the axon and infects ocular cells, the white matter to cell-to-cell fusion. Cell-to-cell fusion property of DNA is a critical factor for induction of the malignity. So, to understand how the identity state can split from the matter to white matter and infect the white matter cells, we target it to the fusion peptide because fusion peptide of the spike protein is responsible for the fusogenicity that was actually hypothesized and speculated for lots of studies, but no one able to show why it is so our studies first time showed by comparing the myelinating state with the two protein and non-myelinating state with the single protein by taking the advantage of minimum as well as molecular dynamic studies that the diagonal fluctuation of the fusion peptide segment was placed wherever two consecutive protein is there, so they cannot fluctuate very well and they cannot hold the membrane, but when there is a single protein, they can actually make a hole in the membrane and these protein use utility in the fusion peptide may be responsible for fusion properties of the mutant coronavirus lineage. So then we combine these properties to understand the viral not only the cell fusion but also the viral strain from the point of injection to the retinal ganglion cells because we know virus causes retrograde axonal transport as well as the virus moves from the brain where we included that the to the brain state and from there the spinal cord where it causes demyelination and you can see that when two protein is there, the virus is causing severe encephalitis viral entities present in large amount in the white matter as well as in the gray matter and IVA1 that is mitochondrial antibodies are present throughout the white matter as well as the gray matter and as a result virus causes as I showed you macrophages. Its mind causes severe demyelination. Right? In one way, the cell-to-cell fusion is much more restricted. You can see here, they do not cause seizure and the viral antigen is much less quantity. And there are the infection is there, but that is really restricted into the gray matter, not much white matter distribution of the IVA1 positive cells, and there are no demyelination. At the same time, as I told you, from the laboratory nuclei, they follow the retrograde axonal transport and make the retinal ganglion nucleus where they cause a cell-to-cell split. And viral antigen is very much spread throughout the retinal ganglion nucleus, whereas in single protein, we see the lack of the fusogenicity and the lack of the state virus to reach to the retinal ganglion cell. There is not much presence of viral antigen. And as a cause, we are seeing that dimethyl fluctuation of the two protein is mainly responsible for cell-to-cell fusion, and two consecutive protein in the fusion peptide is required for dimethyl fluctuation, restricted dimethyl fluctuation, and cell-to-cell fusion is the main determinant of acute stage viral antigen spread and chronic stage immunopathology. And cell-to-cell spread can help virus to create the immune system and personal response. And as a result, we see uncontrolled viral replication and impaired DNA host immunity, which actually causes the virus to propagate fast and mount the host immunity, which is helping the virus to clear, but at the same time, it is also causing demyelination. One can see with the double this my fix Serapos with almost species. He is working on that to show that we can design a multi-peptide and that can be used as antiviral against human coronavirus. And then we will submit that to the human to say that it might have the potential to design for current coronavirus and then highlight properties of this cytokine activation we can use to design the antiviral. So if I conclude what we have observed so far, the virus spike protein plays critical role in cell fusion, viral antigen spread, and most immune response leading to immunopathogenesis, and encodes spike protein recombinase, myelin strain, anti-cephalic and non-myelin strain, anti-cephalic virus in their immunopathogenic outcome, and two consecutive protein in the center of the fusion peptide are into the immunity states. So when we gather all the information, then we also wanted to study whether we can restrict the cell fusion. And a group of people in our lab, Ravi Sharma and Mr. Abbas, in coordination with Dr. Onam Muntazam, work on this project, and a large number of undergraduates work to understand whether traditional the medicinal plant EPA extract can ameliorate the viral induced cell fusion and contribute to the inflammation, and they need or study taking the advantage of that. We can inject the virus as well as we can deliver the EPA extract to gastric coverage or to direct inoculation, and we observe that as a reactor, the mark extract and these unique isomers restricts with the coronavirus infection. Here we developed a virtual center with United States as well as United States in Sweden to study the SARS-CoV-2 because we do not have the facility at our institute, and we have very limited facility in India where the entry is restricted. So we collaborated to have virtual like blood, and we showed a large group of people were able to show that both SARS-CoV and MERS-CoV can be restricted, replication can be restricted by as a reactive data, which is EPA extract and its in isomers. Whereas we also showed very elegantly mouse virus in inflammatory violation, and axonal loss is also restricted by using the EPA experimental model system. So why we do that? We wanted to see that if it is true in understanding the viral induced myelination and axonal loss, our studies significantly contributed in understanding the pathobiology. But how we can shed light in understanding the myelination and neuropathological outcome in human coronaviruses. So in 2019, we spoke to trying to understand, and there were lots of literature which were summarized very nicely in brain behavior and immunity. The nervous system can be an intense role of SARS-CoV because intercoronaviruses, from our experience with the event coronavirus, we know that the direct infection on the virus can use neural epithelium, both integrated axonal transport, and can infect the central nervous system. And central nervous system has a connection to the lung, so virus can propagate from the brain to lung also. At the same time, lung to brain also it can go and by contagious dissemination. So they differentiate transited root of SARS-CoV infection in the CNS can also affect the brain stem, and brain stem regulates a function of the neural system, so it can cause the regulation of the UIDs, and that also like why we are interested to understand the brain to lung and lung to brain axis of the virus through antebrain and brain to brain axonal transport was also interested to see because also we infected the small intestine and the stomach as well as kidney, liver, so from the intake system also intake neurons, the virus can be access to the brainstem and there again can control the respiratory system. So brainstem respiratory system infection causes respiratory disease, and that is possible to transsynaptic axonal transport. We got the most of the information by integrated neural to olfactory route is the every coronavirus system. So that we were asked to like reviews, like to understand whether we can play the neurological symptoms by taking the insights from the different coronavirus and the immunology and Dr. Faria Sadi, we would about that like reviews what of that is related coronavirus, which is reproductive disease, how can shape life, this biology of SARS-CoV. And what we were doing there, as I mentioned, the viral speaks like when it is coming to the ARDS level in the lung and causing ARDS, but it can infect the brain, brain stem can be infected, and in the small intestine, it can also go through a deep system, and altogether it can cause the bleaching of the virus throughout the central nervous system as well as the peripheral organs like lung, liver, kidney, spleen, and as well as the intestine. And hence we have a large body of data from several series of studies to prove that spike protein plays a major role. So virus study actually collated all the information about the coronavirus and shape like to understand how spike like protein is central to the coronavirus pathogenesis and she forced the barrier into the substance. So that only we very good. I everyone that we will very of the long term. So here I would like to like to break here to say that our lab, like I have set up a lab in 2008 in October 2018 in Isaac, Calcutta, as I was introduced that I'm faculty was there. And last 15 years, there are number of students and collaborators. You understand the neurobiology, immunology, people biology, as well as the biology of diseases. Take the help of structural biology, design, immunomodulators, and antibiotic therapies. And that way we are trying to understand why do you infection that neurotropic biology is infection, how it causes inflammation as I showed it to you, and how it can lead to regeneration, which leads to people called long-term disease. So that's why we are using this model in vitro and in vivo experimental approaches to understand neuroimmunity using Boolean discovery. We one last try to understand neuroinflammation as I already showed it to you. And we showed that when you get this supplies and microbial notion, how they are attributed to neuroinflammation. We have the neuropathological tools and techniques to show the validating drugs is accumulated by a large number of fluid field and vacuum field microfiles which are acidic in nature. From a chemistry standpoint, you can see how it causes cellular pathology, ascoriosis, erythropoiesis, neuronal dystrophy, as well as axonal concentration and demyelination. And altogether, we also use a large number of compromise to understand the new checkpoint, how this immune system are interacting with this immune system, and that's what we will be talking today. So here, I would like to shift the gear a little bit about demyelination and axonal loss. As I told you, this model mimics certain pathology of human neurological disease multiple sclerosis. So what happened? All of us know that myelination is very important for the nerve impulse propagation. If the myelination is not here, nerve impulse cannot propagate to the axon, and that is actually causing the restriction of circulatory action. And you can see here in the left side that is a myelinated region where myelination is a concentric rings of PLP, MOF peptide, and all this forms these proteins that myelin structures. And here you can see these myelin structures. This is axoplasm, and the pause studies as well as the literature studies, we can see body generates up to that interest myelin protein. And highly reactive T cells cross blood-brain barrier and have myelin and cause. And that's what a large number of people are showing on in supply model in A. But our studies is opposite because it is not the T cell which is migrating first, This gather the inflammation in the CNS cells, specific neuron astrocytes, microglia, and lymphocytes infection. That infection leads to new inflammation. This new inflammation brings that cell. So that's what our field has advantage to study that all the time in this patient will prescribe the immune suppression, but that may not actually give any remedy for viral immunization, rather it causes opposite effect. So we need to design a therapeutics taking the advantage of this innate immune intervention, which I will show you. So this is the multiple sclerosis. If you are aware of this disease, that this disease is not prevalent in this area, but in countries closer to the poles are more into multiple sclerosis. That is a latitude relation phase due to ozone layer and the direct sunlight, as well as European area that has highest incidence of illness. In India, the incidence is very low. But one point is that there may be lots of unconsidered patients who have started with the advantage of the MRI, but previously it was not maybe categorized as ALS, maybe categorized as other neurological diseases. So in that neurological disease leads to the neurodegenerative inflammatory autoimmune disease, predominantly white matter disease in the central nervous system, including brain, spinal cord, and optica. Mind shift degenerates causes demyelination and that impedance of the nerve impulsive axis. So multiple sclerosis is the most common neurological disease among young adults and it needs attention in India, which is also can be considered as neurodegenerative disease because immune inflammation leads to degeneration. So these are the symptoms. There is a demyelination as I showed you already, while inflammation, how it leads to myelinations, immune inflammation, completely internal depression, sweating, unstable mood. There are visual defects, speech musculoskeletal condition problem, bowel disorders, and urinary disorders. So, for people try to understand the etiology, maybe the truth nobody knows which type of patient develop what type of multiple sclerosis. There are different type of chronic progressive or acute sclerosis and encephalitis, as well as there is a progressive secondary disorders. So, but when you study the pathogenesis, we know from the etiology aspect that autoimmunity that CD4 T cells attacks the myelin and can destroy the myelin sheaths in the clears that and macrophages strip the myelin. That would be one of the mechanisms for myelin-induced myelination. Whereas other factors like ozone, food habits, and the dark microbiota can also cause the disease. But there are most prevalent one, which is the focus of our studies, that there are like some pathogen interaction like mycoplasma pneumonia, chlamydia pneumonia, as well as human indigenous retrovirus and herpes virus, and there are also some fungal infection which can lead to the disease. But one of the problem to understand in human because there are in the brain lots of viruses are harbors identity, so it is difficult to see which virus is causing that disease. So that's what we use the model. And in this model, so what happens from the model, what we gather the information, if any viruses attacks the cellular system, first thing will be viral infection, and then viral infection will be happening through pathogen associated molecular pattern scans for cells to recognize the presence of the virus, and when virus will be recognized, it is the adenovirus, aortic and then there will be active cellular sensors like clears, iris, and CTAS, and then pathogen recognition receptor will interact with viral nucleic acid that scans, and then there will be activation of cellular sensors which uses interferon synthesis by secretion of viral kinase dopamine transcription factors. And this interferon system is very important topic to understand the viral pathogens. So to do that, a large number of studies are available, but Peresco in 2015 summarized that very nicely that interferon induces the synthesis of more than 300 interferon stimulating genes through the interferon binds to the interferon receptors, activation of transcription factors, TAP1 and 9 TF3 and see that the simulated response element IIC transcription factors binds to the IIC and induces transcription of interference stimulating genes like IHG. One of the IHG is the food, but the human there are two things if we want to be a five, optimize their team, if we want to achieve, and if the two is the most widely studied way and shown value of the best therapy those association with loss of physical abilities. These are the if you compromise with the infected with the Western virus, a mouse virus, a vesicular stomatitis virus, a virus, or a leafy, whether it infects renal circular system or kidneys or lymph node or lungs, liver stream, they restrict viral replication. We need to compromise all these viruses or the severe disease. So, what is it we do? It is a and it is localized in the cytoplasm and activity it does not convey the enzymatic period, inflammation or activity, but it provides the antiviral properties. So how it does, people do not know directly, but we are circulating. It provides the viral RNA or host RNA or host protein, viral protein, and then provides the antiviral properties. But take home message is understanding molecular mechanism of mediated antiviral immunity is not fully understood, though we know it has antiviral properties. So to understand that antiviral properties, we use this knockout mice, to wildlife mice. It's a very low dose of the virus. Most of the mice were dying by bleeding because as I showed you that by day 7 and 8 viral particle clears, but in lipid non-compromise there is a huge load of the viral particle and with that one we of our own techniques and like estimation, cross physiology, immunotherapies, and profiling to understand the disease compared with the wild-type mice with lipid non-compromise. And we observe that if you compromise people have severe clinical symptoms, which is even 2.2 to 2.5, whereas in why it is so? Because there is a large amount of viral load by viral type. If you now compromise compared to wild vectors, and when we observe the viral antigen state, we observe that there is a fractious virus antigen spreading if you now compromise compared to wild vectors. So, as a common phenomenon from the understanding of this inflammatory properties, we found give lots of inflammatory results are there, that's what makes it that. But our observation was just opposite. We observed that wild type mice, even because the DNA produces encephalitis, we are nodule formation as well as meningitis, but in individual knockout mice, they do not have much inflammatory results present in the meninges or in the brain parenchyma or they do not form microglial nodule which is a like IGA1 states monocyte antibodies. So we can say that this is one of the surprising event we observed in knockout mice that is deficiency increase viral immune cellular inflammation and microglial antibodies activation. So we wanted to address the question why this so far we can see widespread infection in not mice. There is a much lower activity of the monocyte microglial antibodies, not for IGA1, but there is an equal amount of infection in the astrocytes and associated inflammation. That put us to understand that vitamin deficiency may be impairs microglial activation but not astrocyte activation. So we wanted to see like what happens because by taking the findings, again I want to show you that by day 7 viral particles started to clear by day complete eradication of the viral particle. This is the time when people knock out mice were dying by day 7 to see. So what is important? So we went back and the Vagina and Paya, these temporal kind of studies and they show that they 7 to 8 actually there are lots of monocyte antibodies as well as T cell at present, where CD8 T cells also come by T cell post infection but they host podocyte macrophages. So that's what we want to see. What is the level of CD4 T cell and into 1.1 T cell? So you will see there is a drastic reduction in the number of CD4 T cell in the inflamed brain documents compared to wild boys as well as H141. There is also less number of cells finding. And we give cytometry to understand the inflammatory dynamics of the inflammatory cells and how we can prove that if minus should restricted CXCR1 expression in the good microglial immune monocytes because in cytometry we observe in the CD45 or CD45 low population, the microglial and CDA mediated populations facing much is alpha like CXCR1. So CXCR1 is one of the activation marker. So we see there are increased disease severity and viral increased viral spread in the CNS, increased CNS inflammation, unwanted protein expression, and impaired lymphocyte migration in the CNS, which is very important point to take a note, and impaired mitochondrial activation because their interaction will be responsible for immunomodulatory. And there is a new CSCR expression which says that mitochondria is impaired in activation in the atmosphere. And we published this paper in PLOS today where we highlighted that if you do either directly or indirectly zero for mitochondrial activation, impaired mitochondrial activation is associated with reduced lymphocyte recruitment, leading to inflammation, and impaired mitochondrial activation and reduced infiltration of migrating T cell may be responsible for disease severity and impact. So if this is true, that's what we have one of the very talented creative students, Mr. Madhav Sharma, who is also almost completing his PhD. He showed very elegantly that not only in active stage, but chronic stage, even at 500 kVs, mice develop severe myelination. And viral particle is still present, as I showed you, viral particle goes through the detection limit, but he showed even at day 30 large amount of viral particles present. So what could happen because T cell was not there, so mitochondria macrophage could not interact with T cells to eradicate the virus, and the presence of the virus is one of the main cause for the severity of the inflammation. And the severity of myelination is also associated with activation of the macrocyte bacteria. Macrophages to phagocytic macrophages as you can see here, and the severity is so high. Surprisingly, active state microglia is impaired of the main active, but impaired microglia activation actually in both relation is that given the leukocyte microenvironment is to be going to because they need to skip the binding. So you can see here this is the phagocytic macrophages compared to the activated macrophages. So that's what it happens like activated causes paralysis, severe chronic myelination, sustained and lethal microglial macrophage activation, even at 500 milligrams of IC-59 activation. And I already showed you that macrophages there stick to the mind. So mitochondria macrophage mediated activity could be one of the cause of this viral induced myelination here and severity of the myelination. So from there we wanted to see whether we can show that protein if you knock out one of these stages that they that and that lies to become highly protein and our studies actually other food basically this study get viral protein that the virus is present in the myelination. So we are directly attacking or the association of the viral antigen is still responsible for the myelination and in high magnification you can see that PLP protein and viral protein are closely associated. So this actually have also shown that myelinating mediator, which is scar nucleus, in wild type there are activated macrophages, alpha-1 positive cells, but the number of macrophages are much more if you do not organize compared to wildlife. So that's what my clear anthropologists usually optimize exhibition development of items similar to wildlife, but there are quite a large number of anthropologists are present, and these anthropologists are sitting in the mind. And Margot actually drafted this paper, which is published in Journal of Virology, that ubiquitous given coronavirus. Maybe the spinal cord analysis associated in my college, when we are concluding that it provides an very fundamental and thereby leading by control, leading severe dehydration. We use distribution of silicon pieces that acoustic leads to phagocytic phenotype, a microglial chronic state leading to increased microglial utilized sleep, and thus develop an imagination which is a new region. So now our study is contraction of cells as an addition to in one hand CD4 cell migration is important and for its interaction with microglial macrophages are also important. And that may work molecularly that CD4 to that. So that's what first we use the CD4 knockout mice and we show both that in absence of CD4, polymorphic here to the inflammation, producing myelinating plaques, abnormal alpha activation to inflammatory filters, which says that CD4 T cells protect from severe xenophobia and myelinating information. So what was started to gather from CD4 knockout mice to transform in CD4 knockout mice. And then we also wanted to see what happens if CD4 T cells, and at the same time, CD4 T cell will be present, but CD4 T ligand is not good. Further pinpoint which molecule is responsible for designing the profile. And we observe in CD4 ligand deficient mice, there is a damping activation of microglial monocyte macrophages because there is a much less sensation of CXCCL1, MMG class 2, and CD1. And then we showed that in CD40 knockout mice, there is a huge expression, even at K30, there is a large expression of the IPA1 protein in the brain, as well as the sort. See large number of phagocytic monocyte and macrophages are present, and they are released in the mind. So CD40 protects against mouse hepatitis virus inflammation and inflammation. It is unique because in AD or in multiple sclerosis, people show could make this secure delighted, actually causes pathogenic properties, but here CD4 T cells, CD4 delighted, will provide really high expression. So, by taking all the data to that stuff, we are now can conclude and summarize our data, saying that our model is different than the model, and the vital is migration and external loss, especially the microorganization and external loss, is not carried by adaptive immune cells like we see and discuss patients or in clinic. But with this area of specialized T cells and anti-order antibodies produced from the human instead of that, these will make a innate immunity and opportunities to adapt to immunity. So designing the anti-viral therapy is very important because anti-immune properties or immune substances may not work for viral diseases. So I showed you some of my salient findings, but we produced a large number of paper through this process to understand and maybe only involved with the viral inflammation triggers this inflammation due to the infection. It is the major cause for adaptive immunity which causes immune degeneration. And published a lot of papers also in Journal of Infectious, Journal of Viruses, Virology, and a large number of other work is there, which I, with 9% I am not able to because I only show you the imagination part in these studies. I am thinking about the structure functional analysis of the spike protein and the therapeutics. But our lab also work with cells and communication where we show that astrocytes and communication is very important to maintain the health of the myelination, which is altered due to viral infection. We also study the viral use for the response, so we can also use it as a target for therapies. And we already showed you by student control vaccine properties, we showed that the spike protein is very responsible for viral induced myelination. So design a myelination peptide what Mr. Abbas is working will also help to understand whether we can design the antivirus by using the fusion. So while I have a long-standing experience to work with different coronavirus includes the migration and external in mouse model system, I was gifted with a project by Sister Medicine Cluster to develop cancer models, mouse models for cervical and ovarian cancer, and this therapeutic with this model. Group of people also working in the cancer biology aspect, which is a very new field in our lab, which I will show you later to you. And now the presentation of finding lab is understanding complex gene mechanism and pathogenesis towards electrical animal model and the cell culture model. I showed you the data for multiple sclerosis and myelination and external loss. I also have models to understand absolutely use cell family and designing gene mice model for designing novel therapies. But whatever is the model, we will be trying to do is study transcriptome, protein functions, cytokine information, and identification for good kinetics, immune cell activity, immune modulation, structure function analysis to understand the pathological outcome, which is very diseases, and virtual screening to understand the molecular dynamics of these simple science. So with that, actually, we are very lucky to have a virtual center between US and Cameroon States and India. And we already showed, I have showed you the paper for academic technical where we work together. But now I was asked to set up a center for translational research. This is biology where we are collaborating with this Africa, Netherlands, which is a main source to our institute, and I'm also have collaborators for all over the African region as well as to the Indian to the India as well as in US, in the Southwestern University, University of Pennsylvania, NIH, Bethesda, Institute of University, University of Columbia, and Alabama, and Dutch University of Center. So the main take home message is connectivity because I have a large experience to work with mouse model system, but now I think my study should be clear to us translational research where we successfully apply our knowledge to understand the viral infection and the inflammation which are the major cause of degeneration. So the entire mode of basically this is the work actually the data generated by a large number of very talented and educated students, among which these students already graduated, and I have 13 graduate students who are working in different aspects of the biology, evaluation, and cancer biology. And I am also very happy with my collaborators, especially Madison, for giving me the opportunity to work with the sabbatical in knockout mice. Cornelia Baumann was also implemented. She postdocs on science courses, studies, and Maria Nietzsche, Ravi Mahalikam, industry lab, the Michael Google, David Group, and this institute. We have a factual center to understand the viral use, design that therapy by understanding the viral use pathogenesis, and we already produced one paper which was published in biology to show that we can work done. And I also have collaborators at India like Netherlands and ISC organization activities in Azerbaijan and on Isaac. And I'm very thankful to Isaac giving me a very talented, smart group of students, graduate students, and college students who are going the fear of these projects or all these data what I showed you. And I'm thankful that throughout my last 15 years journey as a publica, I was funded by different funding bodies in India as well as in IUS, CSIR, IUS, SGF, India, Business Society, University Department of Biotechnology, CRT, Medical Society of Microbiology, then inspire these videos. I will that CSR also gave a large number of videos. We also have to be videos. This is a big contribution from the government side towards the growth of our land. And that's what I thank all of the students and the
Thank you, ma'am, for this. Right. Thank you, ma'am, for this great speech and presentation. On behalf of Charlotte College and the participants of this event, I would like to extend our heartfelt gratitude to Dr. Jayashree Raj Sharma for gracing us with her presence. The dedicated work of your research group and your extensive insight into the work of neurodegenerative immunity models and the role of murine beta coronaviruses in inflammation and virus-induced demyelination has not only broadened our understanding but also ignited curious and enthusiastic in our participants. Thank you again, ma'am, for this great experience and expertise from your wealth of experience. Once again, I'm sorry. Next, I would like to welcome Mr. S1 for hosting the next session.
Good afternoon, everyone present here. I hope I can welcome you to the third session on this international seminar, what neurodegenerative disorders and inflammation. I request Dr. Basurajesh Balamasar to occupy a seat on the dais. I also request Dr. Anantachar Joshi sir to occupy a seat in the dais who is chairing this session. Welcome you, sir. I request Dr. Yan Venkatrao sir to occupy a seat in the dais who is co-chair this session. Welcome you, sir. It is my privilege and honor to introduce the resource person of the session, Dr. Basran S. Kalapal, Senior Scientist, Center for Dementia Research, National Institute of Psychiatric Research, Orangeburg, New York, USA. Sir has done Masters in Biochemistry, MPhil in Sea Technology, PhD in Biochemistry from University of Mysore. He also has a postdoctoral in genetic engineering from Indian Institute of Science, Bangalore, and psychopharmacology and neuroscience from Columbia University Medical Center, New York. For the past 27 years, his research has been dedicated to understanding of the molecular and epigenetic intricacies of alcohol use disorders, with a particular emphasis on fetal alcohol spectrum disorders. At the core of this investigation has been a steadfast focus on understanding the role of endocannabinoids in alcohol abuse disorders. His most recently completed projects include impact of prenatal stress on alcohol use disorders related to behaviors, CDA-mediated signaling in developmental ethanol effects, endosome dysfunction in Alzheimer's disease, endocannabinoid signaling in postnatal ethanol effects, role of endocannabinoid signaling in alcoholism. He has been a research scientist since 1995 up to 2021 at NYS Psychiatric Institute, Columbia University Medical Center, New York. Presently, he is the chairperson for Individual Fellowship Review Panel. He has been honored with Lady Tata Memorial Research Fellowship from Lady Tata Memorial Trust, Bombay, India, and Senior Research Fellowship from Council of Scientific and Industrial Research, New Delhi, India. He is currently the editorial board member, Frontiers in Molecular Neuroscience, the Open Edition Journal, Brain Sciences, Disease and Annals of Neurodegeneration, EC Proteomics, and Bioinformatics. He is also the external examiner for evaluating PhD cases submitted to the University of Mysore, JSS University, Mysore, and Pune and India. It is a privilege and honor to have you as a resource person here for this session. I once again welcome you, sir, for this session. I also take the opportunity of introducing the chair for this session, Dr. Hamanta Chand Joshi. Dr. Hamanta Chand Joshi, Professor and Principal, Sharda Das College of Pharmacy, Mysore, completed his doctorate from Division of Farm Sciences, Gurujampeshwar University of Science and Technology, Hisar, Haryana. His research interests are neurosciences, behavioral psychopharmacology, herbal psychotropics, standardization of phytopharmaceuticals, Alzheimer's and Parkinson's disease, and he has more than 20 years of experience in teaching and research. Sir has published 227 research and review papers in scientific journals and presented papers at various national and international conferences. A German patent has been granted to him for herbal preparation for management of dementia on 2022 May. Also, 5 international and Indian patents. We feel honored to have you here as a chair for the session. I once again welcome you, sir. I also welcome Dr. N. Venkat Rao as a co-chair for the session. Dr. N. Venkat Rao, Head Department of Pharmacology, Sharda Das College of Pharmacy, Mysore. Sir has his Masters in Pharmacy from Andhra University, Visakhapatnam, and PhD from the same university. Sir has 34 years of both teaching and research experience with the team happy for you for accepting our invitation as a co-chair for this session. I once again welcome you for this session. I request Dr. Basava S. Balapan sir to take over this session. Over to you, sir.
Can you hear me? Keep it down. I will talk about something. Okay, thank you very much for inviting me. It's a great pleasure to see younger generation interested in science. So I was just talking to Dr. Joshi what kind of audience we have. Should I throw out all the research I have done on these young minds, or just provide some little science where they can get motivated to the field? So what I'm going to do, uh, I will make it very simple and provide you some basic science part, and then I will show you how we use those stuff to understand my hypothesis. Okay? I think that you will appreciate it. And I will make sure I will keep you all attentive. Okay? So if you have any doubt, you can ask me questions. So, so you see the film, you see the pointer? Oh, this is yeah. You have three things here. I have a reason why I took those. Not to show that I am from New York, but you see here, what you see, some exciting stuff are there. Some of them are nice, foods, healthy ones, right? If you eat those, you develop a healthy habits, and your life will be very good, long term. You don't get any age associated diseases. Okay, so you also see some other things. You recognize them. How many of you recognize them? You have here in the class. Wine, yeah. You have two kinds, red wine and white wine. I'm going to talk about it more. That's why I'm asking. So you are able to recognize good and bad, right? So you can make a better decision what you want to do, good or bad, right? So, and you have here, what is that? You understand that what it is? It's a neuron in our brain where they communicate. That's how you are all active and you are responding to, right? Because of this. So I'm going to talk about these two things today. I'm not going to talk about neurodegeneration, Alzheimer's disease, all that, because I'm going to talk about neurodegeneration, but not Alzheimer and other disorders. Uh, that is because we have been working on those disorders, and we published a couple of papers. And I'm just showing a few. They are in a well high impact journals. These work are all done collaboration with a very famous Alzheimer researcher in our NYU Medical Center and in our institute. So this is another research published recently. This is related to Alzheimer's disease. A particular dysfunction happens in the brain that leads to Alzheimer's disease. So if you understand the mechanism, then you can develop a medication so that we can treat those. Okay? So, and then we also did a clinical and preclinical studies in Alzheimer's disease. This is again one specific neurodegenerative disorder. I hope you are understanding what is meant by neurodegeneration. Means loss of neurons in our brain. Okay? So this is just a one type of neuron. We are called cholinergic neurons. So like that, our brain has several uh, neurons, different types, depending on what they do. So we have labeled them based on what they do or what kind of chemicals they release. This is one type of neuron called cholinergic neuron. We just published in a Nature Communication, which is available. So this is about the neurodegeneration associated with age. These are age associated. But age is not just happening, right? We live with it. It's not happening just like that. It has been happening. There is a reason. Some people age faster. Some people age, but they don't look their age. Okay? But some people are in between. What makes them like that? Because we all have all kinds of similar gene background. You forget about the minor changes. We all have the same kind of genes, right? But why some people age faster, some people exhibit a lot of disorders, some people are at 92 or 100 years, they are so happy, they are doing that. So it is all because of our lifestyle. What we do in our life, how we live, what kind of stress we have, how we deal with other people around you, how you wake up, how you spend your day, and then how you end your day. What all you do from morning to evening before you go to bed. Every year for 100 years accumulates in your brain. Causes a pathology. That pathology depending on your lifestyle. How that lifestyle is associated with changing the gene, right? Gene function, the brain function, leading to pathology. So there is an important topic which I am going to touch, that is epigenetics. I'm not sure how many of you know about it. I'm sure you know genetics, right? So epigenetics is nothing but genetics, but we don't change anything on the genetics.
no change in the DNA. You have a DNA, right? You all learn basic biology, and you have nucleotides. Certain number, we call them some names, right? I'm not going to this. And then, if you change one of those letters, we call it as a mutation, right? Because mutation is alteration. So it is no longer a normal one, it doesn't produce the same end product. So the end product is very important, like doing some basic function. When you mutate it, it doesn't do that at all. So you are at dysfunction. So that is a well-known genetic change, mutation, gene mutation we call. And there are a lot of disorders associated with those developmental or age-associated, depending on your habits and all. But there is another factor where you don't see any gene mutation. Your gene nucleotides are organized the way they are. Okay? But because your lifestyle, what you eat, what you drink, what you do all are stress, driving on these population with the full of vehicles, making cars, all that makes your brain stressful. The stress. The stress is a environmental factor, can influence your gene. So what I'm going to talk about is a mechanism that leads to through these genetic mechanism leading to loss of neurons in our brain. But loss of neuron, I'm not going to touch the age associated Alzheimer's or any other, but there is another factor called alcohol. This is also an environmental factor. People use it, abuse it, there is no other word. They abuse it. So just to give an analogy, if you take the market value, right? You know how much rice costs, how much wine costs, how much beer costs, like that. So if you take the industry of alcohol, today, world industry, alcohol, market value is $2,000 billion. Okay, $2,000 billion. If you compare that to the rice we eat every day, the market value of rice is only $250 billion. So what do you think? What people are doing? Eating more rice or drinking alcohol? So in the world, I'm not talking India, America, Mysore, Bangalore, I'm not talking the world. So in the overall world, people are drinking how many ratio you take, right? They are drinking more alcohol than eating their food. So it is a very important stressful event in their life. How frequently they are doing it, how often they do it, what causes not only to their brain, to other brain, spouse, children, the society, and the accidents, brain injury. So there are so much loss associated with alcohol drinking. So because alcohol drinking is associated with such a great loss to the society, in America there is a big institute called National Institute of Health. They fund people who are interested in doing research like me. They give money and ask you to do research, find the solution, or find the way to treat these people because you cannot ask them to stop drinking. They are not going to listen to you, right? But they are there in the society, you need to take care of them. So, what a government can do is to how to take care of them. What do you mean by taking care of them? So there is a loss of work because someone is caring for them. I'm talking about not the social drinker they drink today and then they meet another friend in a month or 2 months and they go to bar drink. That's fine, they are plenty in the society. They are fine, it is okay to drink. Government says it is legal to drink, who I am to say don't drink. Right? But I'm talking about the same people who are going to bar as a social drinker, one day they turn into addicts. So what is meant by addiction, right? So you have a brain function going on like this. And then you start drinking as a social drinker. In certain people, depending on what age they start drinking, depending on their situation, family, or whatever the situation they are. When I say family, the situation of their emotional status of the day. We don't care much here in this country, I'm telling you. Please don't take me wrong, I'm abusing India just because I'm living in America. No. I'm talking about the way we care other person. We don't really care about other person's emotions. How do they feel? If I say something, how that influence their function. In the morning, before you start going to office, if someone says, "Oh, did you do that?" Then you get irritated. Your brain get activated, and a lot of changes happens in the brain that keeps your brain to function completely in a stress mode. Your whole day is completely spoiled. You will be keep on thinking, what did I do? What happened? Like that. And just think in one example. There are in your life, in the whole 100 years of life, like this are happening every day, every day. How are you handling it? We don't care. In this country, we don't care about it. They don't go to hospital. The brain dysfunction is not considered as a disease. But if you get a headache, you think that, oh, I have a headache, take the medicine. But if your emotions are not good, you think crazy, they say, oh, you are crazy. You don't have to go to hospital. If you have to go to hospital, it's a disease. It's a dangerous disease, leads to violence, leads to killing people. Fortunately, not many people have guns in this country. Whereas in America, people have guns everywhere. So a person goes crazy in 5 minutes, he can kill 100 people in next 10 minutes. I'm sure you have been watching on the news media, going to school, killing teachers, students. And we cannot enter any building without going to do the scan. So if you think about the brain function, how it is, that your liver or kidney, or your stomach pain, those are all minor, but this is the major one. So the brain disease or brain addiction, these are very important part of society in the Western countries. So they invest a lot of money to do the research. So my research is funded by an institute called National Institute of Alcohol and Alcoholism. This institute has plenty of money just for the alcohol-related brain disorders. Okay. So I'm going to talk about that. Within that, I'm going to touch the mechanism how alcohol causes epigenetic changes. That's going to change the gene expression. That going to change the synaptic function, and how that synaptic function is going to cause our brain function. So I'm going to start with the molecular mechanism and the synaptic function, and then I will show you in the animals behavior how we can change. And I will walk you through. I will not go through the details of it because we may not appreciate it, but you will appreciate these things quickly. Okay. And then I will tell you what we are doing for the future. It may be too much for you, for me to just to tell you what we are doing. I will I told you about how the alcohol is impacting the society and your surrounding, how you can be dangerous if you are an addict. I'm not talking about social reasons, I'm talking about others. But if this happens in a woman, she is planning to have a baby. She is planning to conceive a baby. Or if she is pregnant and if she drinks alcohol. We are not talking about her brain. We are talking about the baby which is growing in the womb, how that affects the brain. And you are creating another generation of brain disorder. Okay? So this disorder is not so severe so far in India, but it is a very severe issue in Western countries, including America. What is it? So all the effects related to the fetus exposing to alcohol in the womb, whatever the effects you get in the fetus, is all fetal alcohol spectrum. There are so many things you can detect on that baby. we call the spectrum disorders. So FESD, the one common word. But if this happens, a woman is addict, alcohol addict. The one I didn't tell you the what addicts do. So it's not the muscle problem, it's the brain problem. Right? For whatever the reason they are addicted and now they cannot live without drinking alcohol as a normal human being. If they are addicted and they drink alcohol yesterday night, morning they have to drink alcohol again in order to be normal. Okay? I don't know, I'm sure a lot of addicts are in this country and I don't know whether you have come across any alcohol addict and you smell alcohol in the morning. How many of you be? No? It's true. Most of the alcohol addicts drink in the morning to be normal whole day. And again they evening drink. So the reason why they drink is they cannot avoid. They cannot live avoiding alcohol. Their brain is completely changed from here to here. In order to be normal, they need some weight of alcohol to keep this here. As soon as the alcohol goes, they come here, no? Because they are not normal at this level, they cannot function as normal. So you need to have some amount of alcohol so that they can be. What happens is even if they unknowingly or knowingly become pregnant, they know the baby is growing and I should not drink alcohol, but they cannot avoid it. They are forced to drink alcohol. So in that situation, what happens is the baby is constantly exposed to alcohol until it departs. The another factor in this situation is if you ask any alcohol drinkers, okay, hey, how much alcohol you drink? Oh, no, I drink less. Are you sure? Yeah, I drink very less, but they drink a lot. They lie, right? Is that true? So what happens is we don't have exact amount of alcohol exposed with us because mothers lie. Oh, I must have drank some and I don't remember. And because they go only when the baby is not doing well, they go to hospital, the pediatrician. They recognize some of the symptoms related to alcohol. Then they say, oh, did you drink alcohol when you were pregnant? Oh, maybe I must have drunk. They don't tell how much when, even if they know, they don't tell. So that has caused a lot of confusion in the research because we were not able to tell how much alcohol is required to cause how much damage. Is there any correlation? So we don't have that. And it has become a big factor in creating animal models to study the cortex so that we can at least improve the baby life, improve the baby cognitive functions, so their IQs. They can do little better in these schools and their life, they can have their own job, they can maintain their families. So, at least they can live little better lives so they are less burden to the society. So that's the whole idea of this national stop alcohol and alcohol. So because of that, see how much money it costs. So if this is a very severe form where the addict drink every day and the baby you can recognize whether it is a fetal alcohol syndrome or not. If I see a person, I can tell whether this person has a fetal alcohol syndrome or not. It's a very severe form of syndrome. And you can see there is a see here, see the gap from the nose. This area is very wide, and the upper lip is inside. So it's very thin and it's inside. And there are so many features you can see here. See here. So there is a physical feature overall at the time. And if this severe form costs $1.4 million just to take care of one patient. Okay? But whereas other factors like I said, the fetal alcohol spectrum disorder, that cost 6 billion annually because they are more cognitively impaired than these structural forms. So the question here is, as I told, how much is dangerous, how fast you drink, how much at each sitting you drink, all that is important. And also, what is the your pregnancy stage, probably middle later stage. So depending on that, you see the severity in the damage. Okay. So if you take a fetal alcohol syndrome in the model where the baby is exposed to alcohol long time. This is just a 5-year-old children brain. If you see that the fast one is completely shrink, whereas the normal one looks beautiful. If you see the severity, the brain. And if you look at the fetal alcohol spectrum disorder, this is a very mild exposed brain. You don't see any major structural change, but there you don't see any visible effects, but they are cognitively impaired. These are much more dangerous because they look normal, but they are not able to function normally. So these are the kids suffer a lot because they look normal, they go to school, they cannot concentrate, and they cannot socialize, and they have anxiety, and their learning and memory is very, very low. So they have become a problem to the society. So I'm not, so in every 1 in 20, you will see fetal alcohol spectrum disorder in the world. Okay? If 20 kids are born today, at least one is fetal alcohol spectrum disorder. So some of the defects are lifelong, so it is a burden to the society. Because it is a major disorder, we need to understand the mechanism and identify some of the targets where we can improve their life by understanding the mechanism. So definitely we cannot do this research in pregnant women, definitely not. So we have created some animal models where we can understand certain aspects. We cannot reproduce completely the human condition, but at least certain changes can be detected using animal models. That's about the introduction about fetal alcohol. Now, because I'm going to connect the alcohol effects to epigenetics and to this matter, I will give you a brief introduction to the epigenetics and I'm sure I will try to make you understand. So you have a liver, right? You have a brain. Do we have a different genes for liver or brain, or all genes in our body are same? Same, right? Every cell has the same gene. But how come the gene which makes the liver, the same gene makes the brain? Strange, right? Have you asked this question yourself? We all start with one cell, one gene, right? Then you multiply, differentiate, and make different brain regions, you make different organs, they completely function different. How all this orchestrated during development is by epigenetics. So what happens is early all the genes required. For example, if you take a liver genes, all the genes required for brain and liver are there, but all the brain genes in the liver are completely suppressed by this mechanism, and only the liver related genes are expressed, and that particular organ becomes liver. The same thing, if you take a brain, in the initial when they are differentiating, all the genes for brain, all the genes for liver, kidney are all there. But all are suppressed by epigenetic mechanism. And other are allowed to express. There are developmental disadvantages you are seeing now. In animals, we are having two eggs, we're having extra leg, all those are because of these epigenetic changes. So, as I said, there is no change in the nucleic acid, but it is exists in every developmental stage, whether it is in the womb or in the baby or in the adults or in the age. So they are all important in every developmental stage of our life. And it is constantly happening and it is dynamic. It changes depending on how you behave. You scream, there is a change. If you are calm, there is a change. So it is all reflected in your gene expression by this mechanism. So what is it? So you have a chromosome, right? And then chromosome is wired along the histone proteins and making it a chromatin. So the longer genes are all put together in a small nucleus in the form of chromatin. So if you open up the chromatin, you see the histone proteins and you see a DNA sequence. So all the DNA sequence can be methylated, that's called DNA methylation. They have a function. Once they are methylated, I'm going to talk about it. And then there are histones, they can be methylated or demethylated or acetylated, that will change the gene expression. So all these are influenced by environmental factors, stress, uh, all kinds of anxiety, pollution, alcohol, food habits, you can name it any environmental which goes into your inside your body can influence these changes and changes the and you must have seen changes many things. Oh, he was very good, I don't know what happened to him, right? So this is a very dynamic mechanism that you can change. So that's the layer of epigenetics where histone proteins can be modified, or DNA itself can be methylated or demethylated. That can change the structure of the gene. That influences the gene. So, for example, in DNA methylation, there are enzymes called DNA methyl transferases. They transfer methyl group to the specific cytidine, phosphocytidine region. They are called ions, CPG ions in our gene. So they are the site where DNA can be methylated. If they are not methylated, okay, they are unmethylated, that's a normal situation in our body. That's how it should be. For example, if they are methylated more, what happens is that if it happens in a particular gene, that gene will be suppressed. But there are enzymes called cancer translocation. They transfer methyl group, whereas they remove the methyl. So there are activators or inhibitors for these molecules. Those can be used to, depending on the situation in any particular disease, to treat those clinically, so that we can change the situation and make expression or inhibition of that particular gene. So that's the whole story why we are interested in studying this. This is about DNA manipulation. So there is also, I said, histones can be modulated. So as I said, histones are surrounded by genes, and that whole thing is called nucleosome. Those histones, if they are methylated, if they are not methylated, the chromatin is relaxed. That's the normal situation, and the gene expression takes place. That's the healthy condition. But if they are methylated, the chromatin becomes more compact, so it inhibits the gene expression. Okay, so this process is done by histone methyl transferases. They transfer methyl group. There are enzymes, they also remove methyl. So these two enzymes becomes a target for treating any disease associated with this mechanism. So there is another one called histone acetylation. So histone acetylation is opposite to histone methylation. See, if you have a highly acylated histones, the chromatin is relaxed and it expresses gene very well. That's the normal situation. If those histones are removed for whatever the reason, then the chromatin becomes compact and they cannot express gene and inhibit. So there is a inhibition of gene expression. If it happens in a particular disease, that becomes a target, treatment target. So this process, de-acetylation, is done by histone deacetylases. There are different classes, and addition of acetylation to histone protein is done by HACs. They are called histone acetylation transferase. And there are activators, and the inhibitors are available, so they can be very potential clinical targets. So I am going to be published a lot of work on histone integration, DNA integration, and I am only talking today how the histone acetylation can be a target in fetal or spectrum disorder. Okay. So since we cannot do this human studies, we have animal model. So the animal model is very simple. You may get questions. So because alcohol, I told you alcohol drinking is, is not known. How frequently they drink, when they drink, how long they drink, how much they drink, we have no idea. So we have to fix our parameters to understand the mechanism. So in one of the models, we use this particular stage of development. There are other models, they use very early development, middle of the development, and all throughout the development, depending on the question you have in order to understand the mechanism. So today, we have been using different models, but today I am only using this particular model. This model is equivalent to week 29 and week 40. This is the third trimester pregnancy in women. Okay, equivalent. So what really happens at this stage is more synaptogenesis. I am sure you know what is synaptogenesis. I'm going to talk about synapses and all. So generation of synaptogenesis takes place in the third trimester. So what happens is during development, baby is born with so more than required neurons. So if we need 1 million neurons, when they are born with 3 million neurons. The reason is during the synaptogenesis, formation of circuit, in the brain, during this stage, so some of the neurons cannot get a partner to make a synapse. If they don't get a partner, they die. So in order to have a perfect brain, so the nature has a mechanism. So they make more neurons to have enough good connections, brain connections. So the rest, they don't make connections, they die. So that's why we make more neurons. That stage is called synaptogenesis. Okay? So these mice, this is a very sensitive period because during this time, as I said, some cells die, right? So if alcohol is exposed at this stage, instead of only those neurons, unsuccessful neurons, supposed to die, right? Instead of that, even those neurons are looking for the partner also die. So you will see more than required cell die. What happens? You are disturbing the formation of circuit. So you have a less mature brain. So that's why we are more interested in this particular sensitivity. There are other sensitivities. You have a different hypothesis. So we have two doses, very low dose and 2.5 gram. We give directly to the mice pot. It's a 7-day-old mice pot. Okay? Baby mice. This is the dose equivalent to 4 to 5 days in about 2 hours if you are sitting in a hall. If you are drinking, the small beer bottle, have you seen small beer bottle? No? Good. So there is odd liquor, whiskey. Whiskey is very little. You cannot fill the top. That's like a 10 drinks. So if you take 1 ounce of that, that's what it is equal. Or if you are drinking a glass of wine, not the glass full of wine, okay? Glass of wine is only 4 ounces, just whiskey in the big wine glass. So if you take that 4 to 5 drinks in a one sitting within 2 hours, the conditions will be created this way. So if you do this is called binge-like drinking because you're drinking sip by sip for 2 hours. So it's called binge-like drinking. So what happens in this model, you see a lots of neurons, as before you what it happens. And if you allow these mice to adult stage, you'll see a lot of synaptic dysfunction and then the behavioral deficits which I'm going to show. You see here, you see the difference, right? I'm not telling what it is at all. So if you see here in the ethanol group, you see all those dark spots. All those are neurons marked to die. Okay? All those neurons will be lost later. But there is a mechanism where we can detect it, which is called caspase-3 staining. So these are all labeled to die. Okay? So you can see how much neurons are marked to die. And you can quantify that, and you can see we only recorded the hippocampus, which is very important for learning and memory, and the cortex, which along with the hippocampus, they are involved in higher cognitive function. And you can also do immunoblotting. It's a technique where you can detect proteins. If you do take the brain section and do immunostaining, immunoelectron microscope, you see the nucleus in the northern one and the nucleus in the other one is completely messed up. There is a scientific name, I'm not going to tell you because you cannot appreciate it. You can appreciate it is messed up. You don't want to have the nucleus messed up, right? So that means the cell is able to die. So if it dies, it's not going to survive. So you see there is a loss of neurons by exposing to alcohol at this particular stage of development. So what we did now, we reduced the amount of alcohol instead of 2.5 gram, we just gave very 1 gram. You see the difference? It's less dark. So less cell death, right? So it is indicating that it is a dose dependent. The more you drink alcohol, the more cells will be able to die. You can detect with blood. Since I told you we were interested in instrument escalation, because of our extensive previous studies, this is the hypothesis we formulated to understand the mechanism. There are 3 de-acetalases. They remove acetyl group from histone. So we wanted to look at that and see whether histones are playing any role in causing this neurodegeneration and show you how it's connected. Changes in these proteins and then labeling those cells to that. So what we did is we just because nobody studied how these histone acetalases we call ADA, right? Oh, sorry. I think I went too far. So we wanted to see how these are expressed during the normal development, from early development to until adult. So there is a slight difference the way they are expressed, but they are expressed now. So especially the ADA3 is expressed less during early development, but they are more during adolescent and in the adult stage. Whereas ADA1 and ADA2 are more in the early and then they come down a little bit during adult stage. So now what we did is we took the tissue, hippocampus and the cortex from those 1 gram and 2.5 higher and lower dose alcohol exposed tissues. And then we did immunoblood, which is a very important protein detection method. And you can see here the blood, and then you look at here, proteins are ADA2, ADA1, ADA2, ADA3, all are increased in a time dependent manner. After exposing, after treating mice with alcohol, you can take out like 4 hours, 8 hours, 24, you can see that those definitely increase. It's the same story with higher dose and lower dose. You can also detect by staining these products by immunohistochemistry, where you take sections of the brain and then you incubate with those antibodies and then you attach to a coloring another antibody so that we can look at them under the microscope where you can see colorful nucleus. Each one is a nucleus, whereas the red is labeled with one antibody, whereas the green one is a NUN antibody, only labels neurons, no other cells in the brain. So when you combine and you see a yellow, wherever you see yellow, that is the co-localization of ADAC in that particular neuron. So you can quantify it. You can see there, see ADAC1 is in the hippocampus has different brain regions, and we only look at CA1. And also cortex is so broad, we cannot do the whole brain immunohistochemistry. This is called retroscenial cortex. Where you saw the high too much drop cell there, that's the reason. And you can see there, the ADAC1 increased. Same story with ADAC2, and then same story with ADAC3. So it is very clear, both low dose and high dose are increasing ADAC1 and ADAC2, ADAC3. That's the final outcome of this. Now, because ADAC remove histone acetyl group from histone, right? So we need to know what histone proteins are really target of these. There are many. We biased and we picked some of the well-known major histone proteins. I will tell you what is these label. See, within the histone there are four kinds. Histone 1, 2, 3, 4. These are called isomers. Okay? So we have only took two kinds, X3 and H4. The acetylation happened only on the lysine group 14 in X3 protein, whereas here lysine 8. So there are many. Only we took these two for our studies as an example. And you can see because the products are increased, they remove acetyl group, so you have a reduced acetylation. I told you in the beginning what happens if you remove acetyl group from histone, you are making chromatin compact. So you are going to inhibit gene expression if it happens on a particular gene area. Okay? Same story with the high dose alcohol, okay? Both of those. I told you this particular histone acetylation is taking place on a particular gene promoter region. So we can pick those genes and see whether these changes are happening on those genes, which are important for the synaptic function. So we did some gene expression studies. It's very simple. You take the tissue, you do RT-PCR. I don't know whether you guys are aware of this. So you can detect mRNA and quantify it. So we did some, these genes we have selected, they are very important for synapse function, neuronal function in the brain. Because we are going to connect these whole changes to the synaptic function and cognitive function. So we choose some. Among those, we only studied extensively on two of those. They are called ARC and BCR. ARC is a very important protein. For example, if you run on a treadmill, right? If I provide an activity for a person, RI minds, you make running and you take the brain out, 1 hour, 2 hours, running, you take the brain and take off the hippocampus and staying for these proteins, they are go up. Means they are activity induced proteins. If you have those, you feel better, you do better. Your cognitive function is better. So that's why we selected these two. You look at those two are reduced in this model. So we suspected probably those ADAC changes or histone changes are happening on these gene promoter regions, which I am going to show you all the time. So now, because we saw neurodegeneration taking place, ADAC changes, histone changes, and now gene changes, right? What happens if you leave these mice? This is all done immediately, within 48 hours. But now you leave these mice to grow adult because the problem is in the adult. We have to deal with the adult. kids. So if you look at those two genes are still impaired in the adult stage. That means they are very important. We need to keep them up to the normal. So they are gone now. Okay? And even if the gene expression are down, protein are down. So that's a important parameter required now. Now what we have to demonstrate, those adults which are reduced and the histone proteins which are the adults are increased and histone proteins are reduced, are they happening on the ARC or ECR1 gene or not? So there is a method for which we can detect. So the best method is called chip assay. It's a chromatin immunoprecipitation assay. So what we are going to do now, I will explain, this is a very important method. I mean, extensively used in a epigenetic laboratory, right? You take the hippocampus, remove from the mice, control and alpha expose. And now you have to fix everything the way they are in the mice. Where the gene is there, where the arak is there, where the stone is there, everything has to be fixed with a chemical way. There is a method. Paraformaldehyde free, those sections we can fix everything wherever they are. That's very important. We don't want them to move, right? We have to fix them. So there is a cross thinking which is called. We cross think everything, so now we know wherever they are. Now, subject to lysis, now you lysis it. You have to make a DNA fragments around 500 base pairs. Not less, not big, because those are the ideal size. There is a method sonication and all, well standardized. You can create only 500 base pairs in a DNA fragments. And now take those, incubate with several antibodies, because we are interested in knowing ARAC1, ARAC2, ARAC3, and the X3K14 and the X4K8. We also use CBP. I will tell you what it is. CBP is nothing but Krebs binding protein, which has histone acetyl transferase activity. Opposite to ARAC. And then intubating, immunoprecipitated, washing. Now, whatever you have DNA, they are all the genes which are attached with the alarm. Or they are attached with the histone 14 or 8. Only you are pulling those fragments. You separate them, and then now you create a primer for these two genes, ECR1 and ARC. Take those fragments, incubate them, and do RT-PCR. So you are only expressing those genes, and then see whether you pull those or these specific genes. So this is going to explain whether the ADAR enriched on this gene body or not. So that is a mechanism where we can connect to saying that these genes expression is regulated by epigenetic mechanism. So after that, what we did is, so this is the final outcome of that experiment. So if you look at the ECR gene body, so we have ADAR1 enriched, ADAR2 less, but it is enriched, ADAR3 is enriched. Whereas the SBK14 acetylation is increased, supposed to be less, right? For unknowingly it is increased. So that means that may not play a big role on that particular gene. X4K8 acetylation on that gene is not changed. The globally it is changed, but not that on that gene. And then CBT is reduced. So that means CBT is supposed to add acetyl group is also reduced. So it's an important point. If you look at the ARC gene, again, we didn't see any ARAC1 enrichment at that particular gene, whereas ARAC2 and ARAC3 are increased, and histone acetylation 14 is reduced. So I think those are important, whereas X4K8 is not even changed on this gene. So that histone acetylation is not at all have any role in this two genes. CBT of course is reduced. So that showing that the ARAC binding to the ARC or EGR gene is responsible for the expression of those genes that causes puberty. But still, it is not clear. How do you know that all these are endocrine causing neurodegeneration, right? You don't know. We are not here. So another way of doing is we take the inhibitor for the RRs. So there are inhibitors, several of them, and we don't have a specific inhibitor for RR1, RR2, or RR3. So scientists are working on developing those specific, but currently whatever available are a broader inhibitor. They inhibit class 1, class 2 inhibitor. So the glycostatin is the one we selected for this study. We did a two set of experiments. What we did is we treated mice with glycostatin before exposing to alcohol, 40 minutes before. Now you give alcohol. And then we took out the tissues at 24, whether the immunoglot or extraimmunos. In another set of experiment, we allowed the alcohol exposed or saline mice to adult. Then we gave TSA to those mice and see whether we can rescue some of the effects in the adult mice. So I showed you this cleaved caspase as a marker for cell death, right? When we treated TSA 20 minutes before ethanol exposure, and we used different doses of that drug, you see how nicely it is reduced the level of cell death. It completely prevents the cell death at 0.5 milligram or 0.25 milligram. So this is directly linking the neurodegeneration and the activation of so that can be shown here on immunohistochemistry, the ethanol which we saw before that, right? And now you see that the drug is completely reversed. There is no cell death, no layer of cell death. And you can quantify that in the hippocampus region as well as in the retrospinal cortex. You can also look at the gene expression in the same tissues. So the TSA completely rescued the loss of ECR1 or ARC mRNA as well as protein. So again, confirming that RR play a big role in neurodegeneration induced by alcohol exposure. So now, you know that chupacabtagene, you remember? So now we need chupacabtagene for all the four groups: saline ethanol, TSA allowed, TSA with ethanol. And now you see, you cannot do it adults because we are not we are inhibiting adult. We have to look at the downstream. So the downstream is only the acylation. So even though SDK14 is not playing big role, but it is increased, the TSA is actually reduced in this. So we are working more on that. Whereas with ARC, you see the reduced SDK14 is completely reversed. So again, confirming it is going to be represented. Because I told you the ECR1 and ARC are very important for synaptic function and also cognitive function. So we further extended our studies to the synaptic aspect of the function. So now I will give you a brief introduction of how our brain operates. Now our brain has several cells. We call them neurons, right? So we have neurons supported by other cells called glial or oligodendrocytes or astrocytes. They provide growth factors, right, to the neurons to develop our function normally. So we need all of that. But the important function done by the brain neurotransmission is by neurons. So if you look at how the neurons are organized in the brain, so there is a neuron, there is a neuron, there is a neuron. So we label depending on their organized pre, post, pre, post. Okay. So between pre and post there is a small gap. We call that synapse. So there is no physical connection between neurons. That gap is very important. Neurotransmitter have to release there. and then they have to bind with the other neurons. So that part is very important. That can be studied. We have a method to study that. So, if you look at that synapse, you have a neurotransmitter vesicles where they keep the neurotransmitters, they release when you need them. And then there are receptors on the postsynaptic terminal, so they go and bind, and that's how they send the signal to further in the circuit. We can study that, use that concept in our model, and we can study whether that has any effect. All those epigenetic changes resulted in loss of synapse function or not. We can study. So, so you are normal now, right? So if I ask you run for 5 minutes, that's called activity. So whenever you do something, you are providing activity to your brain. That means when you have a normal brain, so there is certain amount of neurotransmitter release, and then they go and bind the postsynaptic. This is a normal. But if you enhance it, you have more neurotransmitter release, and then more postsynaptic receptors are inserted. That's why they say if you are more active, you don't get Alzheimer's disease. That is because you are keeping this synapse is more strengthened. So you have more neurotransmitter releasing and more activity is going on. So that neuron is not going to try at all because you are keeping it so active. If you don't do anything, if you stay like that for long, that neuron will be removed from your brain because you are not doing anything with it. Anything not required in your body is supposed to be eliminated because it is an energy consuming event for your brain. So that is why being active is very important. So this whole thing is called long-term potentiation. You can do this. I'm sorry, I have to take some activity. So we can measure this by a method called long-term potentiation. For understanding this whole mechanism, there is a three scientists got award, Nobel Prize, just to understanding the signaling mechanism involved in this process. One is from Sweden, another two are from New York City, and one is from our university, Columbia University. His name is Blake Kendall. I am using one of the techniques used in his lab. I learned through his student, he was my mentor. So I had an opportunity to meet Nobel laureate and also work with his students. So I am very proud to tell you. So the technique I am talking here is actually what is that and installed in my lab. We are extensively using that for different aspects in my lab. This is a very important technique where you can go to the level of synapse, measure the synaptic neurotransmitter release, and you convert all the data to a presentable, and that is, you can say whether that particular neuron, mice, synaptic strength is weak or strong, or defective or not. So that's the whole idea of having this. So this was Dr. Javier Alonso is the student of Nobel laureate, and he was my mentor for some of these studies. I don't think I should go details because it's more technical. But this is the technique we are using for this. See, if you take these mice, remove the hippocampus, and then you put it in those instruments, and we can measure the neurotransmitter release, and then you convert the data, digital data into a presentable data. And this is how it looks. See, if you look at the lower one, the ethanol exposure has a very low long-term potential. That means they are severely impaired in synaptic plasticity. And that can be reversed when you treated these mice with ESA. You can see it here also. So that's the defect in synaptic plasticity where we detected it and we can reverse it. Right? So now, whether that is reflected in the animal behavior. So these are very fun experiments where we can do. You can see how the mice is impaired in its behavior. That is exactly the way we feel it. It's a very simple behavior. So there is an activity chamber, and you have two objects. First, we don't keep any objects. There is an empty activity chamber. You put the mice, whether it is saline or alcohol treated, and then the investigate, make sure that the animal is not getting excited or fear or anything, so that it can move freely without any fear. So you can do that 5 minutes twice for 2 days, so that the mice is comfortable moving around with the chair. Now you bring back. Now you put two objects. They look exactly same. The top one, round ones. Okay? Now you put mice for 3 minutes, and then you measure where the mice is spending most of its time. So, as we expect, it should spend time on both the objects equally because they both look alike, right? Yeah. This is a very important technique if you look at your babies. If you have a baby, you bring a toy. It plays very well for a few days until you bring a new toy. When you bring a new toy, it doesn't go with the old toy. It plays more with the new toy. So it's a natural tendency to motivate it towards the novel objects and novel stuff. You don't go to your vacation on same spot again and again, right? Why? Because you want to explore it. So it's the same concept. So when you and then you take the mice out from there after 24 hours, you bring back. Now you change the one object with a different, completely a different object. Now you ask the mice, go and spend time. So you record everything, how much time and what is doing, everything. Then you can plot it. So total exploration in the chamber not changed. But if you look at the discrimination between the familiar versus novel, they are completely impaired. The alcohol exposed animals is not at all remembering the first object versus the second object, the familiar versus novel. See the alcohol impaired. So that is an indication that these mice are impaired in their learning and memory. And that can be reversed with this drug by inhibiting our enzyme. You can also confirm this with another behavior, which is called white means. So what you do here, you take the white means, you label A, B, C, and now you block one of the arm. Now you put the mice in the center and ask the mice to go and explore. You measure everything, how much time, where it is going A, B, or C, and how much time it is spending. And you can plot it. So we look at both male and female. The number of R entries and the number of the discrimination is between the. So when you plot one control mice, it has a tendency to explore now, right? As soon as you put the mice in the center, we block C, right? It goes to C first because it has not seen that area. So it immediately goes normal. Whereas the impaired one, it doesn't discriminate because it has no memory what it did before. So it goes other chambers everywhere. So that can affect the DM. So the alcohol exposure has no memory of the familiar versus now. And that can be treated with TSA and rescue. So this one, so those are all TSA treated before 30 minutes before the event, right? Now we took these adult mice, injected with the TSA for 4 weeks. It's like a drug treatment in a clinical setup. And then we do the same memory test. And in that situation also TSA is completely rescued. Both the number of parliamentaries and also any models. So just to summarize, so alcohol exposure which causes neurodegeneration enhances ADAP1, ADAP2, ADAP3 and also some histone acylation changes that can be rescued by inhibiting ADAP1. This chain also causes neurodegeneration can be prevented by using that particular inhibitor. That whole process leads to synaptic plasticity defect can be rescued again with the drug and also behavior in mice. Of course, so the future, what we are doing is we are doing more bioinformatics where we have done RNA transcription, RNA-seq, which is done mostly in our NYU core facility. You give the tissues and prepare RNA and give the RNA to them. They will sequence whole global sequencing. You can annotize it, do a bioinformatic analysis, and identify what are the targets which are already characterized. They are involved in chromatin, or involved in development, or in behavior. You can identify many more novel targets. That's what we are doing now. So we are interested in one of the chromatin remodeling enzyme called ECS2 is on the top. See this significantly gene. So right now we are that's a very important enzyme which methylates a very specific histone. If you methylate those histones, it creates a compact chromatin. So we are interested in understanding this part of the chromatin is also playing a role in our model. So for that, now what we are doing is we are creating a mice model where we are trying to understand the role of ECS2 in a neuron specific manner. I said we have more different kinds of neurons, right? So we are trying to delete this only in the excitatory neurons. They are called glutamatergic neurons. And see whether alcohol is effective in a very cell-type specific manner. So in this pattern of reading, we can delete ECS2 in only glutamatergic neurons, and these are called conditional knockout mice. And those will be very useful in understanding more specific mechanisms. And that's what we are doing. Of course, all this work is not impossible without a beautiful my lab people, and also a lot of collaborators around different universities in your area, as well as in Texas, also in us. And if you have any silly questions, I'm happy to answer. Go ahead and ask. Thank you.
The session is open for interaction. If there are any doubts, queries, questions, you can ask.
Hello. So it's a really good talk, inspiring a lot. What is the percentage of the ethanol you have used in your experience?
I think we use 5%, but we don't inject directly alcohol. We have a formula where we use other solutions along with 2.5 gram of alcohol. So that is equivalent to the amount I showed you.
No, you are taking absolute alcohol.
Oh, no, no. Yeah, yeah, of course.
It is very important.
Oh, yeah, yeah, yeah.
Because prevalence is very percentage of alcohol.
Yeah, yeah. My dad has been working on this for years.
Yeah,
So,
that is one question. Second one, what will be the impact of methanol, especially?
in our alcohol solution, there is no methanol.
Yeah, no, methanol is okay.
We are not supposed to give methanol to babies, animals. So we have no idea.
Methanol is very,
We are not allowed to do that because methanol is toxic.
okay. Study you can do.
No, no, no. We don't cheat the system.
Thank you.
So,
Good afternoon.
thank you.
I'm asking a layman's question.
Go ahead. I'm very happy to answer any kind of question. After all, we are communicating. What is the big deal? Good or bad? No issues.
Why I'm asking this question is I was myself a victim of depression. In this case, since you touched on the topic, I am just asking a couple of questions regarding it. Now, this Alzheimer's, suppose unfortunately my mother is victim of the trait of dementia, can it be reversed if it is done at an early stage?
Early stage.
From past 4 5 years,
What are you talking about early stage? What age you are talking? Early stage. See,
she is pushing 84. So she had the symptoms sometimes 78 when she was 78, 79. Now she has symptom of dementia, it's become a character now. It will be a managing symptom. Suppose this were to be noticed in a much earlier stage, was there a role for reversal?
it's a great question, and I'm very happy that I am able to talk to a person from the family. Unfortunately, we published a paper in Nature, one of the clinical study. We did a clinical study. The drug is where, unfortunately, we did a clinical as well as preclinical. I was involved in preclinical aspects. Preclinically, it works great. All the parameters we did, both synaptic plasticity, behavior, everything works. When they use the drug patients, the group of patients we have are from the 50 centers distributed throughout the world. And all these 50 centers scientists were involved. The whole idea here is to get a combination of population because Alzheimer's patients respond differently. We don't know the reason why. So just to come to your question, can you reverse it? Right now, no.
Just a day or two back, in Beyond News, I happened to see your Mount Sinai West University. Mount Sinai West
Constantly, yeah,
You have mentioned there about US. They have come out with some treatment where a pacemaker, which used to be generally a piece of the heart for generally implanting the heart or so. There is a chance that pacemakers likely to find a place in the brain which can be helpful. I mean, a kind of impression patients because we know the margin is very huge there. Why depression rates, suicide depression, and that's the only knows.
See, those are all experimental findings, but they are not gone to the clinical population. The problem arises when you go to a population of people with different symptoms, level of symptoms, and their life is different. You get a mixed picture. If you are doing, I showed you a nice data, right? Are you happy to look at my data? But when you go to clinical setup and you take, we have a mice, they are all almost the same. But when you go to a clinical studies with a different population, we get a very mixed results. So that is why it is very, very hard to have a drug which is safe to treat these old people. You know, you take, I'm not saying you are old. What I'm saying is if old people take a medication, even a normal person, if you take a painkiller, you have a lot of side effects. If a 16-year-old kid can take two painkiller, it is fine. Whereas the same two pills, if you give it to old people, they have a different problem. Do you call that drug is safe? No. It is yes, it is not. So it's all because of a very complex population.
Last question. I have my own friend who is a psychiatrist in Mexico. She comes and says something about my mother. I had about depression about 2 decades back. That period, I was not very sure, and it was not the stigma. Now the stigma is totally dying. At least in our country, or in a small town like Mexico, the stigma is slowly diminishing. Now, in that circumstances, she was telling me there is a possibility, like, many, I mean, there are many, because she is a doctor, so would say that she knows that she is a hospital. So, they try to get attached to some sort of vices, be it smoking, drinking, womanizing, etc., etc., etc. So, is that true? Because a friend of mine is suffering.
It's a very complex question, but I will try my best to answer.
I'm sorry to give you a complex.
See, again, depression is a very complex brain disease. We all ignore it very easily. If you go to a person next sitting next to you, no, I am a very depressed person, you will get away and go. We have a very bad society. I'm sorry to say. We don't have people, empathetic people. When you express your pain, they want to create more pain to you than relieving the pain. Whatever the way they want. We create a discrimination in the society. Today you are a depression person and a normal person, or a color person and a bright color person, men and women, children and boys, girls. I don't want to go into more details. I'm just telling you, we create such a pathetic situation. Why? There is no need. We have to be the all human beings to come here to live happily. Create a society where we can all live. I know everybody is competing for their food, but that's just for food. You are not going to take anything from this land. You are going to live it here. So people have to understand this. The basic. We need money to live. How much money you need to live? People don't put a limit on it. They want make money, whatever the brand way they can. And then they leave it someone and they go away empty because they are not supposed to carry money. Right? So because of this society non-empathetic situation adds up to the depression. But if you ask scientific question for depression, definitely it is a brain disorder, and we have a solution for depression, not for problem. Because depression can be treated if the person who is under depression admit that I am in a depression. Most of the situation, what happens is the psychiatric issues, people are afraid of expressing it. Once they express it, the society is not going to take them out. Especially I'm talking in our Indian society. It is well accepted in Western countries. They have a platform. They go to psychiatrists. They get a treatment like the way you get for your migraine headache or any other headache. They give you medicine. You are happy. There they do it. If they have a mental issue, they go to a psychiatrist. But here, if you have a mental issue, you don't even tell your wife because you are afraid how she is going to treat you next day.
Connect a small statement. I'm not anonymous has given a big even in India, it is similarly, I was told that I am not being told by these interactive sessions. They are just told that even in a small town like even Mysore, now there's people are around depression. They are beating after a
Yeah. So I really complete my answer. So the 50% of the treatment for depression is the person has to admit that he has depression. And then seek the solution and meet a perfect correct people. There are I don't want to undermine anybody's knowledge, but there are people who want to misuse me. So that's what I switched my talk to the society. So So what I am trying to tell you, so you have to go get proper treatment facilities so that it can be treated. It is just resistant treatment. Depression is treatment. Not the age associated brain disorders like Alzheimer's. The depression, if you are having anxiety, if you are tensed up or something, there are treatments. You just have to go and seek in a proper place. I don't have much knowledge in India of what kind of facilities they have. I'm sure they have, but the depression is treatment. But only thing is you have to advocate. See, most of the time, what happens is if someone is mentally sick, it becomes a pathetic situation instead of giving a comfort to you. So, because now the way our society is, we always treated brain disorder as something not treatable or it's okay. I have no idea. It's a very wrong concept. This is the disease, whether it is a liver or a kidney or a brain, right? Why do you discriminate? No, we should seek medical solution. Yeah. Oh, thank you. I'm very happy to talk to you. Yeah.
Uh, as far as my knowledge goes, maybe the situation is when people kids, we have to make a psychologist and something else. I think it has improved a lot.
I'm happy to know.
Even I'm proud of you.
So my question is related to your related to your generation. The Indian youth, as we see in the world compared to other countries, India has the majority of the youth generation in the world population as the dominating area, and they say India has the right to majority of the youth in the working class. But most of the youth are getting into the night shift jobs, such as video jobs, vehicle jobs, or medical coding jobs, as companies are US based, IT based, they often accept attractive salaries. But what will be the future of the Indian generation, new generation? The majority of the people are getting this night shift jobs. They are rebalancing their sleep cycle. So this will be leading to a great neurodegeneration of the youth population. A vast majority in the long-term scale, it will be a great impact for the future of the country. So what will be your point of view on this? How can this be managed?
I'm very happy to tell you. Sleep is very important. Even a normal person, if he doesn't sleep 8 hours or 7 hours or 6 hours, next day is a very crazy day. Crazy for yourself. I'm not talking to your head next year. And you will be irritated and you don't work, your work quality goes down. and of course, so it's a disaster. And sleep has been associated. So sleep deprived people have, if that disturbance continues for a long time, their neurons are dying because they are not getting what they are supposed to. During sleep, most of the things you love in the daytime will be inserted into your hippocampal circuit to store so that you remember. That's how it works. You do whatever you do in the daytime, the night is the time for your brain. Your brain is active 24 hours. The only time it can insert all the information you learned in the daytime will be only in the night time. So if you don't sleep and you are awake again in the night, brain gets confused. What's happening here? I am not getting time for what my job, right? So it is a pathetic condition, and there are a lot of studies going on. Um, I don't know what to tell you about specifics, but sleep is very important. With respect to what is going on with the job and all, of course, we need to address some of these societal requirements of your own situation. Certain people take this very good. They adjust their cycle very well. Those who are working in the night, they try to sleep in the daytime very well, and they do that. For whatever the reason that particular person cannot handle this situation, it is better for him to change the job rather than messing up your brain, and that leads to a terrible situation later. And they are 10 to age faster than the normal people, right? So, yeah.
Thank you for the very interesting presentation. My name is Alira Das. I'm from JS Short, also from Science Studio, Mysore. My question is that you told us that both high and low doses of alcoholism, the recovery can become psychoactive from attack suppression. So my question is there any threshold for that? Like only up to a certain degree of alcoholism or related or up to a certain extent or quantity of time for prolonged conditions, can that recovery be done, or is it for any extent?
I'm not very clear about your question. Second part, I heard some those effects.
Is there a threshold for this recovery? Like only up to a certain extent of alcoholism or related headache suppression, glycosamine can recover the cellular cells, or is it for any quantity of alcohol for any amount of time? Your study showed a high and low doses.
So is there any saturation? That's what I'm asking.
Yes, sir.
It's a good question, but it's a very tough question. And I don't have answer. But with my knowledge, I can just tell you overall. Here, the minimum amount of alcohol which causes neurodegeneration or any effect is most important than the top level. Oh, okay, after that there is no effect, I can drink that much. No. Any amount is. For pregnant women, we say no alcohol. No alcohol. Okay? So there is no safe level. Because the reason is, so for example, you are not pregnant, but you are planning to conceive. And you don't know whether you are pregnant or not, and you go for a social drink and you drink one drink. You think, oh, I'm okay with one drink. No, it's not. Because you don't know what stage of your pregnancy. You have no idea. So because the stage of pregnancy has a different sensitivity for any amount of alcohol, so it is dangerous to drink at any stage. Any little amount, I'm talking. You are talking very high, I think you have a different range. No, you cannot. So any dose, the minimum is I showed you very low. It's a 2 grains in this case. But if that 2 grains in the third trimester, if the 2 grains in the early first trimester, so a lot of these very low dose alcohol effects happening. I don't know about the Indian society, but in American society, uh, people have access to all these stuff. Okay, so if they are in the process and they drink alcohol every day, after 14 years or 16 years, men and women, girls, boys, everybody drinks. Not everybody, but most of them. Okay, so you cannot say, and you are drinking and then you are having other stuff and you are getting pregnant. So you are putting your baby in a risk. That is the reason why fetal alcohol spectrum disorder is very high in Western countries than here. It's going to happen here. I see a lot of ladies are drinking here, but not yet.
Thank you, sir.
Thank you, sir. If you have still more questions, you can ask afterwards. We are running short of time. And now I request Dr. Ananda Chatterjee and Venkata sir to speak few words for this session.
Before that, I really want to thank you all for your patience. I hope I made you to understand a little bit about epigenetics and neuroscience, which can motivate some of you to perceive this area of a human being, how to become a normal, a good human being, to maintain your brain health. Okay, thank you.
Am I audible? So first of all, congratulations for this one. And there was a small apprehension, when I was about to start. What will be, how will be received? And I was very thinking, there were so many questions that I think still is in the mind. There is some kind of hesitation from your experience. I have one question, especially in the mind of DNA. Because there are always contradictory statements in alcohol is concerned. Because many people, they are in support of alcohol. Maybe it's industrial perspective or whatever. Because we see many people, especially the doctors, say that this is a problem. This is a chemical, it's a medical chemical in the red grapes, especially red wine. Normally, it's going to be a protective and as well as only a protective partners. At the same time, we also have alcohol induced neurodegeneration, especially alcohol induced omniscience, as well as the English person. What is your thought on that? So, can we get briefly?
Yeah. So this question has been asked every time I give a talk on alcohol, because they think that drinking a little bit of wine, like Western countries, a glass of wine just before dinner. This is a very cultural dish. If you go to Western countries where most of the population is enriched with Christians, they have this culture. I'm not saying it is. It's not a thing, but it has been there. But there is absolutely no link. I'm talking directly. There are correlations. I don't believe in correlation. I believe in direct. So any amount of alcohol is not good. But so that means you should not drink as a social drinker. Yes, you can. People do it for many reasons. It actually enriches your body with the person you are drinking. They become very good friends, very sporty friends. But as long as you are in your limit and you know how much you can handle it and how, and then if you sense it as a sensible issue. So okay, if I'm drinking one glass of wine, I have one, glass of whiskey or whatever. It's fine, but so the wine and the art disease, the connection is with the wine loss in the grapes. And we really want antioxidants to drink grapes, you eat grapes.
So we need to develop the effects of alcohol, benefits of alcohol. Because it's in the way of something.
Yes.
I will ask one question. See, many people have seen the revelation in most of these slides. Even when is an age-induced neurodegeneration, many times, actually all various factors. What is your thought? How can we, is it because most things are available, but how can we do it? How the progression of neurodegeneration can be done?
So it has been discussed extensively because that's the only way where we can do better. So the best way to delay aging associated dementia is to be active. And never become a lazy person. Every activity actually makes your brain more brave. So one of the example I gave as a basic principle, more you put your brain into activity, you may be walking, one example. If you walk 2 miles a day, it actually releases, strengthen your neurons. So that the neuron is not going to die. The neurodegeneration is nothing but the loss of those synapses, which store your information you have learned in your life. So if you are active, you can change that. If you are not active, you are going to not everybody. So you are actually going towards that line. So the best way there is to do readings. If you are retired, you do readings. Go on vacation, go and visit a novel place. I just showed you. Go into a novel place to feed your brain. Don't go and sit on the same tree every day. Go to a different tree, sit and talk. Meet your new friends. So everything you do now makes your brain more active. If you are, I'll tell you one example. Previously people had no GPS, right? So what was the way they were going? One way you need to know before going. You have to look the map and where you have to make turns. Left turn, right turn, right. So everything you should store in the brain. So you are putting brain into activity. So now what happened? You are not doing that. Because you go and punch the address on the GPS and the GPS tell you what to do. Your brain is doing something else. It says, oh, make it right turn. So you just stop. You don't think. So you are actually, some of these the advancement or making our brain more lazy. So if you want to keep not to age too fast and develop dementia, the best way is to have a good food habit. Food can influence your brain and brain age. Have a good food habits, lifestyle, do some exercise. Either can be walking or taking gym. You don't have to be a lot. Where you can accept, your body can accept you, because you don't want to get up with the pain. So whatever you can do, but you have to keep your brain thinking, novel and thinking, and try to avoid all negativity in your brain. So that's some best thing you can do.
Fantastic. Thank you so much. And let me thank the organizers here, especially in the area, organized wonderful conference, and especially meeting people like that. And I could see also the university students also. They are doing some little basic research in pharmacy college. Because you have seen, after giving examples of price and all. If you want to visit Hollywood, why not you can visit also. And thanks to Dr. Rosana for the wonderful talk, and definitely we will make some opportunity. Thank you so much. Good afternoon to all. With the permission of the chairperson, I want to speak for 2 minutes. The thing is, basic idea of this session is whether the woman, whether in healthy condition or in pregnant condition, can she drink alcohol? Okay, whether it is a healthy condition or a pregnant condition, what happens is normally families to be favors particularly. And particularly regarding to the information after pregnancy, 18 to 52nd day, one should not administer any type of appointment. Reason for this one is cannot go very easily. Okay, na? And this is the only point I think. And thing is, I have talked about histone escalation. And one more is there, histone de-escalation. Then the ratio of histone escalation and histone de-escalation, that is disturbed. You are suffering with one or other type of diseases. Okay, here, that de-escalation, that is a higher one, that is a lower one. Escalation is a higher one, you are suffering with asthma. And when the escalation process is normal, de-escalation process is very much decreased, then you are suffering with that chronic obstructive pulmonary disease. That's why whatever type of material or whatever type of chemical, when it is imbalancing the that escalate and de-escalate mechanism, automatically we get one type of disease. And one more thing is, and Sir has asked regarding can we reverse the Alzheimer's disease? No. Process is degeneration, but it is not the regeneration. In our body, only for liver, liver is having the character of regeneration, but not the neurons. That is one thing. And Sir has asked, can we use methanol for the testing? No. Reason for this one is, alcohol is converted into here, whereas methanol is converted into folic acid, and it is causing damage of the ICD. And anyhow, and Sir has focused very well on the what is that degeneration. That my sheet is damaged because of this product, the signals those are passing from one neuron to other neuron. And if you come for the simple example, poliomyelitis, polio virus, that is myelitis, inflammation of the myelin sheath. It is just like this one here. And it is damaged, the signal is jumping to other neuron here. That's why what happened, some part of the system which is affected to that of the polio, that is not developed. The left part is very robust, right part is not at all having growth there. This is the problem there. That's why any of the chemical substances that is causing degeneration of the neurons, that will produce one or other type of diseases. Thank you. Thank you.
Now I request Dr. M. Devra, Principal Chartered College, Mysore, and Captain Ali Manjuna, Head Department of Microbiology, to felicitate our resource person as a token of gratitude and respect. I request Dr. Devra, Principal, to present the certificate of appreciation and memento to the chair and co-chair of the session as a token of gratitude and respect. I request Dr. Ian Heidelberg to accept the certificate of appreciation as a token of gratitude and respect. I thank everyone for making this session a successful one. Now I request all the participants to lunch, and the lunch is arranged inside the auditorium, and we'll assemble back by 3, exactly by 3 for the next session.